Today we're opening the doors to take a look inside a community-run childcare centre in Malawi. With support from the Australian Government and UKAID, since 2006, 300,000 orphans and vulnerable children have benefited from centres like this, as part of UNICEF's CARI programme, which works to address the needs of AIDS orphans.
The context in Malawi is 1 in 6 children are orphaned. So imagine that. Imagine in your community, your neighbourhood, if 1 in 6 kids were orphaned. You need somewhere for those children to go where they get a meal, they can learn some skills, they can socialise, and in the long term it prepares them for education. So it really is the most essential child protection program we have in Malawi.
The programme operates in 9 African countries, and it aims to boost the numbers of orphans receiving community and government assistance. It also aims to boost the quality of services preschool children receive before the age of 6.
I feel excited because I see a lot of kids benefiting from early learning and stimulation activities, which will help them to have a strong foundation in life, as well as in school. They'll be able to perform well in school. And the kids that come here are also helped to learn hygiene practices. They learn to use the toilets, they wash hands before eating, and they also listen to stories which stimulate their brain development.
It's estimated that 1 in 5 children in Malawi have stunted growth due to poor nutrition. So part of the CARI programme involves a feeding scheme. With 1.2 million children still needing these services in the country, it's a challenge to narrow the gap.
The gap is big. The gap was like that, and we've now got the gap like that. 1 in 3 children now are attending an early childhood development centre, which is fantastic. The great thing about these centres are they're community owned and run, so it's a very organic process. And so what we're finding now is hundreds and hundreds are opening each year, which is fantastic. But they're very rough around the edges. You know, they're community driven, and the communities have very little support. So where UNICEF and the government needs to come in is to help them develop standards, decent teaching materials, make sure the food the children's getting is nutritious.
While the list of challenges is daunting, there are also positive signs of government commitment this year.
A lot of things that a human being acquires, they come from an early age. You know, if you miss developing that child with all the necessities, good food, proper growing up, all that, you know, circles the child, then there's something that the child will miss in the late life.
Very positive news, primarily through the support of the Australian Government and others. We've now got one of the best child protection laws in this region. It was passed by Parliament only in July, which is fantastic. Now the effort is really going to be about implementation. How to ensure that the legislation translates down to actual results for children on the ground. It's very, very difficult. And I think in terms of Australia, if you think about the chronic levels of abuse that are experienced in very remote communities, we're talking about the same sort of story here. We're talking, as I said before, 1 in 6 children orphaned. We're talking 65% of girls experience some form of abuse by the time they turn 18, 35% of boys. We talk about women who experience domestic violence, something like 2 in 4, which means roughly 3 million children are growing from homes where violence is endemic and considered normal. So that's the challenges for the new law.
We have placed a child as the most important person in our society because that's where we get our leaders from, future leaders.
Bruce, why should Australians care?
Well, I think what Australians are very good at is when we see an individual or a group or a nation trying to help themselves, then we're more than happy to help. We're not so good when we see an individual or a country not willing to help itself. We sort of generally, we're fairly, hands off. But I think in the case of Malawi, it's very much a country that's trying to help itself. It's one of the poorest countries in the world. I think it's the 10th poorest country. The HIV/AIDS epidemic level is sort of like 1 in 11 people. If you think of schools, it's while all children now go to school, which is great, but the teacher-student ratio is 1 teacher, 107 students. one latrine for 450 students. So the country's got a big job to try and fix itself, and it's clearly doing that.
The Australian government has provided funds for training of caregivers, because most of the times the caregivers are volunteers. It has also provided the money for buying play materials, so the Australian government has done quite a lot in this place.